What's bone marrow aspirate? You mentioned it a couple times.
Sorry?
What's bone marrow aspirate? You mentioned it a couple
Yeah,
times.
bone marrow aspirate, good question. That's when you stick a jam shetty needle into, and that's a pretty good sized needle, into someone's iliac crest, and you attempt to suck out bone marrow because that's where the stem cells reside. And there are a number of different products that are out there now that do the same thing, and they'll spin them down and try and concentrate them. But the best they can do is about 6 or 7 times normal concentration. And remember, normal concentration is about 1,000 stem cells per cc of what you aspirate. And that's in a healthy adult. As you age, you have less of those hanging around. The product that you've got delivers at least 50 or 60 or 1,000 per cc. So my chances of having a successful outcome on a surgery is much better with your product than the bone marrow aspirin. Alrighty, so here he is. He's 4 weeks post-op. You saw him at 13 weeks walking. But again, you can see this tremendous amount of bone activity occurring here, where it's just becoming one confluent bone. So it's happening at an accelerated rate. 7 weeks post-op, pretty well fused. This, oh boy. It does it on its own? Does it fix it on its own as well? Okay, so it's self-regenerating. All right, so this is a 39-year-old female. Now, okay, look at that. This is a bad joint. That's a bad joint. She's got arthritis. As I mentioned, she may have actually been a victim of domestic abuse. But she was also not very surgery friendly. I mean, she's 335 pounds. She had an 8-year history of pain, and she needed to have something done. So, 5 days. Boy, this is becoming more freaking. You think the proximity of that is the heat causing that thing to kick off there? Or? Yeah, there we go. So that needs more ventilation. Good diagnostic, huh? Pretty good. Dr. House. There you go. Okay, sorry. I watched that show. I really like it. 5 days, PJ, non-weight bearing, okay. But here she is at 8 weeks. So we got a video, and here she is, and guess what? She's barefoot. She's in my office, all 335 pounds, and she's walking. Alrighty, I'm going to have you turn around and walk away from me now. Holding the dress up a little bit. Very good. Thank you, Brenda. This is 8 weeks. The question was, did she require a boot? And of course she did. But I had her weight bearing around 2 or 3 weeks after surgery. By 8 weeks, she was out of her boot. And that's walking barefoot. There's no X-fix. And normally, at 8 weeks, you're 2 weeks away from putting your foot on the ground. You know, so it's a big difference with regard to combining these type of technologies. It makes a big difference for these patients, and it really impacts them greatly. Let's play this one. It looks like, I just want to make sure that we're actually recording 8 weeks after your triple orthodesis.
Look at you go, girl.
Yeah, she is going great, isn't she? Okay, go ahead and turn around, Brenda, and walk away.
Go take the skirt.
Very good. You'll be on the catwalks of Milan.
Oh, yeah.
Does it normally take for fusion to happen? At 8 weeks, they're not fused yet, correct?
Actually, I've got radiographic. I've got a 73-year-old female that I've showed radiographic evidence of trabeculation across the fusion site at around 4.5 weeks, and she was osteoporotic. In fact, these osteoporotic patients, for me, provided that they're not hypovitaminosis D and that type of thing, if those things are corrected, seem to actually heal faster. The vascularity of the bone is good. You know, your rheumatoid arthritis will fuse faster because they're also somewhat osteoporotic, but the blood flow to the bone is better. Not necessarily always in these cases, but I've got a 67-year-old female, I've got a 66-year-old female, you know, they're walking. One of them is in shoes at 8 weeks. Bessie, love her. Back in shoes. I mean, I've got people who had bunionectomies that aren't back in shoes in 8 weeks. So it's really pretty amazing. But then again, I don't use stem cells in my bunionectomies routinely. All right, subtalar fusion. Here are 3 cases. 73-year-old, she's had a boatload of things anyhow, osteoporosis including it. I had to do some more reconstructive surgery as well, repair the posterior tibial tendon which failed, which caused the arch to collapse. Lengthen the Achilles tendon. All right, she took pain meds. But here you can see that the talus is advanced, just about, it's slammed forward as far as it can go. You can also see the rarefaction of bone. This is not great bone quality. She is 73 years old. She's got some other comorbidities. This is 1 week post-op. Okay. But check this out. This is 4.5 weeks post-op. A single screw, and she's walking. Weight bearing. right through here. That's the joint that was fused. Okay. At 6 weeks, again, take a close look. 73 years old, there's 9 weeks. How many 73-year-olds can you get a fusion on in 9 weeks like that? It's one solid bone right through here. And she was, osteoporotic to begin with. She was very happy. Here's a 59-year-old, and this was, boy, talk about it, problems. She had peripheral neuropathy, 37-year pack history of smoking. Not good for bone healing, right? Deltoid insufficiency, ankle instability, equinus, obesity, hypertension, you name it. I had to do some additional procedures like an anterior ankle arthroplasty, a lateral ankle stabilization, a gastric recession, endoscopic, I typically. After surgery, she took Lyrica for a while and 2 pain pills. Not bad. Check this out. That's the talus out there in space. There's the foot. So basically, you've seen these people who are kind of walking on their ankle. That's what she was doing. That's a collapse. That's bad news. And her bone is so rarefied that this line is not the joint you think it is. It's the joint on the other side of the foot. We're looking through the talus. The talonavicular joint is here. You're looking through the talus to the outside of the foot. That's how transparent that bone is. Not a good candidate.